A retired Norman firefighter who spent several weeks hooked up to a ventilator in a life or death struggle with COVID-19 is urging his fellow Oklahomans to get vaccinated. Steve Shaw traveled to Purcell to speak with the survivor.
Did you cheat death?
I think I did.
Doyle Springs faced death as a Norman firefighter in his hometown, where he graduated from Norman High School in 1977. He started feeling sick the second week of November last year.
I felt like I had a sinus infection. My just all stopped up. My head was hurting and my nose and stuff was running, and then I had eyes that hurt back behind my eyes.
A day later came a crushing fever, the chills, and the sweats.
I was hot, cold all the time.
On November 18th, when Doyle's oxygen level plummeted, his wife Nikki called 911. An ambulance rushed Doyle here to St. Anthony's Hospital in downtown Oklahoma City. That's where Doyle Springs would cling to life for the next 90 days, half of that on a ventilator, which with COVID-19 is one rung above being dead.
I remember once in a while I would wake up and there were pictures of my grandkid, and she had a note there to keep fighting and wants you to come home. And I didn't know anything what that meant.
Incapacitated, heavily sedated, Doyle remembers feeling helpless.
Yeah, it was.
It was kind of a helpless feeling, wasn't it, Doyle?
It was.
During that time, Doyle lost 55 pounds.
A little physical therapist at St. Anthony told me, she said she could hear me after I started coming around in a few weeks there on the respirator. She could hear me saying, "Get me out of here, I got to go to the hospital." She said I was always saying that. So I didn't really know where I was.
And he didn't know that COVID-19 would also claim his older brother Danny, who died a week before Christmas, something Doyle wouldn't learn himself until he himself was out of the woods.
And he was still so bad. And I said, please, please do not tell him yet. He needs to be worrying about fighting for himself.
In January, Doyle Springs was moved from St. Anthony's to Bellevue Health and Rehab Center in Oklahoma City, where he began relearning how to talk and eat and to catch up with his favorite team.
Yes, I missed a lot of it. Missed the bowl game. Didn't even know it was a bowl game. The boy was telling me about it. I done missed it.
Doyle Springs thinks he got the coronavirus early last November at Riverwind Casino, where he worked in transportation for 15 years.
I didn't think it was going to happen to me, but it did. And now I've got to deal with it.
But Doyle doesn't blame anyone. As a matter of fact, Springs appreciates Riverwind and Choctaw Nation, who allowed him to convalesce at their healthcare center in Tallahena from April until he had quite an audience when he insisted on walking out of that facility on June 25th.
I would have just had to come home and not even be able to get out of the chair, could barely walk. And they took me in and gave me OT and PT and told me I could stay as long as I needed to stay. And I wasn't being rushed. I came up with the date of June 25th because I'd been in the hospital so long and I was doing really good. I still can't bend my arm from the elbow myself. And I don't have very much strength in this arm. My fingers curl, but I'm still in physical therapy 3 days a week with the Chickasaw Nation here, PT. And they did wonders with me. They were just super.
Last week, OU researchers announced an international study that identified 13 genes common among severe COVID-19 patients. They say it's a starting point in the quest to really fight off the disease.
They're going to find out why, okay?
That'd be great.
But until they find out, the best thing you can do is to take the vaccine.
Take the vaccine.
If you don't want to take Doyle's word for it, maybe you'll listen to the chief medical officer for the Oklahoma Department of Health.
I just want to reassure people that the vaccines have undergone rigorous testing and rigorous evaluation by the FDA to ensure that they are safe and effective for us to take.
Doctor, I find that stunning that 97% of the people hospitalized with COVID-19 were unvaccinated. If that's the only piece of evidence that we need to get people vaccinated, that's it.
I would agree with your assessment. And like I said, the vaccine does significantly reduce the chance of getting infected in the first place. There's no vaccine that is 100% effective.
Doyle Springs' wife, Nikki, says a close family member refuses to be vaccinated.
She won't get it, and neither will her husband, who's just recuperating from stage 4 melanoma cancer. He won't get it either. And nobody can seem to make me understand what the deal is. You know, I don't believe in it. I don't even think it's FDA approved. I don't know. And I'm like, what the heck? You know what we went through with Doyle. How could you possibly take a chance? Why take a chance? It's just immoral to me, almost.
I would encourage everyone to use those examples and not wait to get the vaccine. I would remind everyone to think of others, like people who have not yet been able to get the vaccine, for example, or other vulnerable age groups. Think of those around you. Remember that the vaccine can save your life or the life of someone that you love, and this is the best way to protect yourself and your loved ones.
As someone who's been to hell and back, you've been to hell and back. What do you say to someone who refuses to get a vaccine?
Get the vaccine. Don't get it. If you go through what I did, you'll be sorry.
Steve Shaw, the Oklahoma News Report.